Did you know that millions of people suffer from poor blood circulation every single day, yet most have never heard of the specific nutrients that can naturally dissolve blood clots and restore healthy blood flow? Recent medical research has uncovered fascinating connections between certain vitamins and our circulatory system that could change everything you think you know about leg pain, swelling, and those uncomfortable tingling sensations. I'm Dr. Elena Carter, a physician with over 10 years of experience specializing in health and quality of life for people over 50, and today I'm going to reveal 4 powerful vitamins that can transform your circulation naturally. You'll discover why almonds eaten at a specific time of day can prevent dangerous clots, how a simple green juice recipe can strengthen your blood vessels, and the common mistake most people make with vitamin supplements that actually increases bleeding risk. Stay with me because I'll walk you through each of these life-changing nutrients step by step, showing you exactly how to use them safely and effectively. Poor circulation is often called the silent enemy, and for good reason. When blood doesn't flow properly through your body, it creates a cascade of problems that can seriously impact your daily life and long-term health. What starts as seemingly minor discomfort can escalate into life-threatening conditions if left unaddressed. The scary truth is that circulation problems affect millions worldwide, yet many people dismiss the early warning signs as just part of getting older. When your circulatory system isn't functioning optimally, your body begins sending distress signals that are impossible to ignore once you know what to look for. The first and most common sign is that persistent tingling or numbness in your feet and legs, especially after sitting or standing for extended periods. This happens because your muscles and nerves aren't receiving adequate oxygen and nutrients. It's your body's way of telling you that something isn't right with your blood flow. Another telltale sign is chronically cold feet, even during warm weather. If your feet feel like ice blocks while the rest of your body maintains normal temperature, this is a clear indication that blood isn't reaching your extremities properly. This temperature difference is one of the most reliable early indicators of circulation issues. Then there are those excruciating muscle cramps that strike during walking or light exercise, forcing you to stop immediately and rest. These aren't ordinary muscle cramps. They're so intense they can leave you breathless. This condition, known as intermittent claudication, occurs when your leg muscles don't receive sufficient oxygen and nutrients during physical activity. It's your body's emergency brake system telling you to slow down. Many people also experience restless leg syndrome, that uncomfortable sensation that makes it nearly impossible to find a comfortable sleeping position. While this can have various causes, it's often linked to circulatory problems or existing nerve issues that worsen when blood flow is compromised. Your skin provides another window into your circulatory health. Pay attention to color changes in your legs and feet, unusual paleness, bluish tints, reddish patches, or brown discoloration, particularly around the ankles. These color variations indicate damaged blood vessels and often mean that even minor wounds will take much longer to heal than they should. Varicose veins and spider veins aren't just cosmetic concerns. They're visible proof that your circulation needs attention. These enlarged, twisted veins with their characteristic blue or purple appearance indicate that the valves inside your veins have weakened and can no longer efficiently pump blood back to your heart, causing it to pool and stagnate. When circulation problems persist, blood begins to thicken and move sluggishly, particularly in your extremities. This is when dangerous blood clots can form, potentially blocking veins or arteries completely. In severe cases, these clots can break free and travel to vital organs, creating life-threatening emergencies. But here's where nature offers us hope and healing. The human body has a remarkable ability to heal and regenerate when given the right nutrients. 4 specific vitamins have been scientifically proven to revitalize circulation, strengthen blood vessels, and naturally prevent dangerous clot formation. These aren't exotic supplements or expensive treatments. They're nutrients found in delicious, everyday foods that you can easily incorporate into your daily routine. What makes these vitamins so powerful is how they work together synergistically. While each one has its own unique benefits for circulation, when combined in your diet, they create a comprehensive defense system against vascular problems. Research has shown that people who maintain adequate levels of these nutrients have significantly lower rates of cardiovascular disease, stroke, and circulation-related complications. The best part is that you don't need to drastically change your lifestyle. Small, consistent dietary adjustments can yield remarkable results. Let's start with vitamin B3, also known as niacin, which acts like a master architect for your entire circulatory system. This remarkable nutrient strengthens blood vessel walls while maintaining their flexibility, preventing the formation of dangerous obstructions and clots. Clinical studies have demonstrated that niacin can improve blood flow by up to 25% in patients with circulation problems. If you're dealing with varicose veins, niacin can significantly improve blood flow and reduce the uncomfortable symptoms associated with poor circulation. What's fascinating about niacin is its dual action on your cardiovascular system. Not only does it improve blood flow, but it also provides powerful protection for your heart by helping to balance cholesterol levels. It actively reduces harmful LDL cholesterol that clogs arteries while boosting beneficial HDL cholesterol that protects your cardiovascular system. Medical research shows that people with optimal niacin levels have a 15% lower risk of heart disease compared to those with deficiencies. As an added benefit, this vitamin supports brain health by enhancing memory and helping prevent cognitive decline. The improved circulation that niacin provides ensures your brain receives adequate oxygen and nutrients, which is crucial for maintaining mental sharpness as we age. You can find this circulation-boosting vitamin in eggs, which make an excellent breakfast choice, chicken breast, fatty fish like salmon and tuna, and nuts such as almonds. The beautiful thing about niacin is that you don't need massive amounts. A balanced diet can easily provide what your body needs. However, be cautious with niacin supplements, as excessive doses can cause uncomfortable flushing and itching sensations. Food sources are always the safer, more effective choice. Vitamin C deserves special recognition as a true champion for blood vessel strength and integrity. Think of it as the reinforcing steel that keeps your arteries and veins strong and resilient against daily wear and tear. This essential vitamin is absolutely crucial for collagen production, the protein that serves as the natural scaffolding for your blood vessels. Without adequate vitamin C, your blood vessels become fragile and prone to damage, much like a building without proper structural support. Recent medical studies have shown that people with higher vitamin C intake have 42% stronger blood vessel walls compared to those with lower levels. When your vitamin C levels are optimal, your risk of developing varicose veins and other circulation problems drops significantly, especially in your legs, where gravitational pressure creates additional challenges. This vitamin also acts as a powerful anti-inflammatory agent, helping to reduce swelling and that heavy, tired feeling in your legs while promoting faster healing of any vascular damage. The antioxidant properties of vitamin C cannot be overstated. Free radicals constantly attack your blood vessels, causing microscopic damage that accumulates over time. Vitamin C neutralizes these harmful compounds before they can weaken your circulation system, essentially acting as a protective shield for your entire vascular network. The best sources are as delicious as they are beneficial. Oranges, lemons, kiwis, strawberries, blueberries, broccoli, bell peppers, and spinach. Here's an interesting fact. A single guava contains more vitamin C than an orange. Always consume these foods fresh whenever possible, as vitamin C degrades when exposed to air and light. While supplements are available, excessive doses can cause digestive upset and may even contribute to kidney stone formation. Vitamin E stands out as an extraordinary ally in both preventing and dissolving blood clots naturally. This powerful antioxidant protects your arteries from oxidative damage caused by free radicals, which can weaken blood vessel walls over time. What makes vitamin E particularly special is its unique ability to prevent blood platelets from sticking together excessively, which is how dangerous clots form in the first place. Research has demonstrated that vitamin E supplementation through food sources can reduce the risk of blood clots by up to 21%. This vitamin also stimulates the production of nitric oxide, a crucial molecule that relaxes blood vessels and allows blood to flow more freely. When your blood vessels are relaxed and flexible, your blood pressure naturally decreases, reducing strain on your entire cardiovascular system. Beyond clot prevention, vitamin E helps maintain the elasticity of your blood vessels, preventing them from becoming stiff and narrow with age. This elasticity is crucial for healthy circulation, as flexible vessels can adapt to changes in blood flow and pressure throughout the day. Studies show that people with adequate vitamin E levels maintain better vascular flexibility well into their 70s and 80s. You'll find this circulation-supporting vitamin in delicious, accessible foods like almonds, pumpkin seeds, sunflower seeds, spinach, broccoli, and avocado, particularly the part closest to the skin. Extra virgin olive oil is another excellent source. Remember that vitamin E is much safer when obtained from whole foods rather than supplements, as high-dose supplements may increase bleeding risk in some individuals. Finally, we come to vitamin K, often misunderstood but absolutely vital for balanced blood clotting. This nutrient acts as a sophisticated regulator, ensuring your blood clots appropriately when needed for healing, while preventing dangerous excessive clotting that could block blood vessels. Think of vitamin K as your body's traffic controller, directing clotting factors to work only where and when they're needed. What many people don't realize is that there are actually two main forms of vitamin K that work together. K1, found primarily in leafy greens, and K2, found primarily in fermented foods. K2, found in fermented foods and animal products. Both forms are essential for optimal circulation health. Vitamin K1 focuses on proper blood clotting, while K2 specializes in keeping calcium in your bones and out of your arteries. But vitamin K's benefits extend far beyond clotting regulation. This vitamin is essential for keeping your arteries clean and flexible by preventing calcium from depositing in the wrong places, such as on blood vessel walls. When calcium builds up in your arteries, they become stiff and narrow, a condition called arterial calcification. Adequate vitamin K intake can reduce arterial calcification by up to 35%, significantly lowering your risk of atherosclerosis and related complications. Medical research has also shown that people with optimal vitamin K levels have a 57% lower risk of dying from heart disease compared to those with deficiencies. This remarkable statistic highlights just how crucial this often overlooked vitamin is for cardiovascular health. You'll find vitamin K abundantly in dark leafy greens that you might have been overlooking: spinach, broccoli, cabbage, romaine lettuce, arugula, and Brussels sprouts. It's also present in liver, eggs, and certain fermented cheeses. A practical way to boost your intake is by preparing a nutrient-rich green smoothie with spinach, broccoli, kiwi, and a splash of lemon juice. Add a small apple for natural sweetness if desired. Since vitamin K is fat-soluble, always pair these foods with healthy fats like nuts, seeds, or a drizzle of olive oil to maximize absorption. If you're taking blood-thinning medications, don't eliminate these foods from your diet. Just maintain consistent intake and keep your healthcare provider informed so they can adjust your medication if necessary. Many people make critical mistakes when trying to improve their circulation through nutrition, and these errors can actually worsen their condition or prevent them from seeing results. One of the most common mistakes is taking high-dose vitamin supplements without understanding the risks or proper dosages. While these vitamins are beneficial, more isn't always better, and excessive amounts can cause adverse effects or interfere with medications. Another frequent error is inconsistent eating patterns. Your body needs steady, regular nutrition to maintain healthy circulation. Some people go on restrictive diets or skip meals, not realizing that this irregular nutrient supply can actually stress their cardiovascular system. Your blood vessels need consistent nourishment to repair themselves and function optimally. Many individuals also focus obsessively on one vitamin while ignoring the others, but these nutrients work best as a team. For example, taking vitamin E without adequate vitamin C can reduce vitamin E's effectiveness, while vitamin K works synergistically with vitamin D for optimal absorption. This is why a balanced, whole food approach is always superior to isolated supplementation. Perhaps the most dangerous mistake is ignoring early warning signs and hoping they'll resolve on their own. Circulation problems typically worsen over time without intervention, and what starts as mild discomfort can progress to serious, life-threatening conditions. Early action is crucial for preventing complications and maintaining long-term vascular health. Some people also make the mistake of dramatically changing their diet overnight, which can shock their system and make it difficult to maintain long-term changes. The most successful approach is gradual, sustainable modifications that become lifelong habits rather than temporary fixes. Here's what you need to remember. Your circulatory health is literally in your hands. Small, consistent changes in your daily nutrition, focusing on these 4 essential vitamins, can create profound improvements in your quality of life. Start by adding 1 serving of vitamin C-rich fruit to your breakfast. Include a handful of almonds as an afternoon snack, prepare that green smoothie twice a week, and make dark leafy greens a regular part of your dinner plate. Consistency is key. These nutrients work best when consumed regularly as part of a balanced diet, rather than in sporadic, large doses. Your heart, your circulation, and your overall well-being will thank you for this investment in your health. Remember, the best medicine is often prevention, and these natural approaches can help you maintain healthy circulation for years to come.